Just on 9:30. On the phone with me now, I've got a man who's going to be talking about digital health. And a lot of us, we have only really started to know about digital health project when it comes to us going to the doctors. We're either on our smartphones or we're on a computer. We're not actually in the doctor's surgery. But to find out more, and especially what it means to the health professional, on the phone right now, Dr. Andrew Rochford from, of course, Digital Health. G'day, Andrew. Thanks for your time, mate.
Absolute pleasure.
Okay, now we've already been speaking a couple of times about what digital health does mean for those who need to access it, like the patients and all that, and what it means for them. But when it comes to the health professional, this is the doctors, this is the nurses, because I still remember myself having a phone hookup with a doctor, and her first words, "I've never done this before." So when it comes to digital health, I mean, what is there available to upskill for the medical professionals to be able to learn how to use this efficiently?
Yeah, I think you raise a very good point. And since the beginning of COVID-19, obviously digital health has become something that's far more obvious to people. We're starting to access telehealth, teleconsultations, connecting with our healthcare professionals over the phone. And that has been as much a new use of skills and tools for patients as it is for healthcare workers. And in healthcare, it's a partnership. It's very much about the healthcare worker in partnership with the patient. So there's two sides to this relationship. And when it comes to digital health, it's no different. So as we as patients are starting to get to know better about how we can interact with our doctors using the telephone, using video conferencing, using smartphone apps, it's the same for healthcare professionals starting to upskill themselves. And so part of what the Australian Digital Health Agency did at the end of last year was a large summit around trying to figure out what are the important parts of moving our healthcare system to a connected system, a system that uses these digital innovations. And one of the large things that came out of that was the importance of health practitioner education and upskilling. So they've created a roadmap into the future, trying to set out how we can start to make sure that healthcare professionals feel just as comfortable with using this technology as patients do, because we know if we can get everybody upskilled, everybody seeing the benefits, then there's going to be better outcomes for everybody.
Yeah, even when it comes to things like, I'm going to just go here for your medical records. People can sign up now to have their records online, which is very, very handy, because if you rock up at a hospital and a doctor doesn't know you and you are unable to tell them any history, any allergies or anything else, they can just access now your records online, which is so much of a lifesaver.
Yeah, absolutely. The My Health record has been around for a while, and then we did get to a period there where if you didn't want your medical records as part of the My Health record, you had to opt out. And if you were one of those people and you've changed your mind, you want to opt back in, very easy. You can jump online and make sure that you are part of that My Health record and you have that digital information online to be accessed by healthcare workers. And the thing about it is it's not just as simple as having your allergies and your prescription medications and your medical history in a place that can be accessed via the internet for a healthcare worker, whether they're in a hospital or in a general practice or wherever they are. It's about how we use that information. And I think that's the important thing about not only getting people more used to having their data in that space, but it's also about getting healthcare workers to understand how they can access it, feel comfortable with using that information and that data, trusting that information, because the evidence is there that when we use these digital technologies to their potential, we see better outcomes for patients. I mean, and the really simple example is being able to cross-reference people's prescription medications with what they might remember. I mean, for a lot of people, it's really hard to remember all the medications you might be on. You might have an outdated sort of list. And I work in emergency, and the crumpled up bits of paper that get pulled out of people's wallets and handbags. Who knows when that was written, whether it's relevant or not. It's so easy for us now just to cross-reference that with the most up-to-date list that's online that pulls all that data from your general practitioner, whoever is prescribing your medication. I think it just takes a lot of the stress and the pressure off simple things like that when it comes to people's healthcare.
Yeah, I know with myself, I've got an actual app on my smartphone because I do have a heart condition. I've got the pacemaker and everything else like that, and all my medications are on my smartphone, which does make it handy. But around Australia, I mean, you're taking a look, and the digital health technology is at different levels, different areas of Australia. What's the training regime for the medical side, the nurses and the doctors, to be able to start bringing their skills up to speed?
Well, this is it. I mean, that's you get to hit the nail on the head there with exactly what needs to happen, and the whole purpose of this roadmap is now to start working with all those stakeholders in different parts of the country to start helping educate, see where the gaps are in education and skill levels, so that we can get everybody up to the same level. So it just becomes, the same as other forms of healthcare education. And I guess at the moment there's funding, government funding, that goes towards certain areas of the healthcare professionals being able to upskill Aboriginal and Torres Strait Islander nurses, midwives, those in remote areas. There's training modules. But the whole idea of what the Digital Health Agency is doing and what will happen into the future is starting to build this educational platform that not only will help existing healthcare professionals upskill to the point where they can feel more comfortable and they can get the most out of digital technology, and also at the same time pass on that education to their patients. But it's also about starting to work with colleges, with universities. We know that the future, the opportunity for people and looking for new jobs, looking to upskill, move into the healthcare sector. I mean, everybody understands now just how much we need a workforce, the human resource that is talented and professional and educated in our healthcare system. And so part of this roadmap is now starting to encourage people to come into healthcare, starting to upskill them at the early stages so that they can use digital technology to push Australia's healthcare system forward.
And as you touched on there, the remote communities, the Indigenous communities, and that, and we have so many. We've got the midwives and the doctors and the nurses and the other health professionals. So what there's emails going out that they then log onto a website. How does it actually work for these people to learn what they need?
Well, the best thing to do is head onto the website, the Australian Digital Health Agency website. You can jump on, just Google that, Australian Digital Health Agency. And there's a lot of resources on there. It gives people the best guidance to how they can be not only upskilled and start to learn about the My Health record, around e-prescriptions. There's also, obviously, there's modules and there's information on there to do with telehealth. And so the best thing to do is just the Australian Digital Health Agency. You can get there at digitalhealth.gov.au. Lots of information on there, also contact points to start to get people involved and give them the information that they need.
And probably one question I do ask, because I suppose when it pops up in people's mind is safety and everything else like that, the ethical use of the information that is online. That must be something that must be of a big priority for people.
Number one priority is the security of their information and safety around how that healthcare information is shared and used. And it's a priority of the Australian Digital Health Agency, and it's a priority of all those that have been involved in the creation of the My Health record and all the policies around how we can start to implement digital health. And I guess the beauty of this roadmap and now moving towards a more formalised way to educate people around digital health in the workforce is also providing them with that knowledge around how they can safely and securely access somebody's information, how they can use that, share that, and make the most of it. But absolutely 100%. Like anything, people's medical information and medical data is hugely valuable to them, and it's hugely useful. And it's just about us making sure that we use it in the right way.
And, of course, people don't realise that. The way I'm looking at it is they don't realise that the digital health technology has been there for a while, allowing doctors to conference from one point of Australia to another to discuss maybe an issue that they're having with a patient. I've even seen it where you've got the patient and the doctor in the room and they're talking to a professional that might be in another state who is a specialist, and it does help the patient and the doctor on the spot.
Yeah, and digital health, I think we all move our mind to the really simple uses of what digital health is, exactly what you said there, which is something as simple as video conferencing, secure video conferencing to do a consultation or get some specialist consultation around somebody's health issues. But there is such a broad landscape of what digital health is. I mean, there's artificial intelligence, there's genomics, there's remote advanced robotics, where there can be a surgeon in one city doing an operation in another place using robotic surgery. These are all parts of the digital health world. They're not common, but they are in use. And I guess what the National Digital Health Workforce and Education Roadmap is about, making sure that our workforce and our health professionals are at a point where, when all this exciting technology starts to become more mainstream, we are more savvy and educated and upskilled to be able to make sure that we maximise that, because the difference can be something huge for a patient.
It can be. In fact, I even saw the other day, there was two issues that I saw. Was a person with an issue with a needed knee surgery. What they actually did, they did an x-ray and did a 3D print of the bones of the knee and the leg in a certain position, and the doctor was actually using and practicing on, or actually using it on this 3D technology where it was millimetre fine, and the patient was in another room.
Absolutely. I think nowadays, I mean, people would probably be completely blown away with how this technology has advanced. I mean, a lot of the time surgeons, especially when it comes to joint replacements, they're using 3D reconstructions to make sure all their measurements and all their cuts are almost set out before they even walk into the room with the patient. And this is the type of technology that just didn't exist in years gone by, but makes a huge difference when it comes to the precision and the safety, and making sure that by the time it does get to the point where you're trying to take away a person's pain, chronic arthritic pain, and change their life, that we've used and harnessed all this brilliant digital innovation to make sure the outcomes are as best as they possibly can be. I mean, that's just scratching the surface. There's going to be so much when it comes to remote monitoring, when it comes to people being able to sort of be monitored when they leave hospital from home, to do with biometrics and everything else. And all of this what feels like futuristic technology will someday become just part of how we look after people and how we look after ourselves.
Yeah, I'm even a subject of that myself, because I do know with myself, I've got the whacker and the pacemaker in. I've got a unit at home. When I go to bed, it takes all the recordings of my heart throughout the day and what it's done, sends it off to the hospital so they can check it out. That wasn't around a couple of years back.
No, well, for us, if something happens to a person with a pacemaker and they come in and they're not sure what happens, we can interrogate, is the word we use, that pacemaker by putting on a piece of digital hardware technology that then actually that does the backup of everything that's occurred. So your pacemaker defibrillator is keeping a record of everything that's occurred. So if something happened, you might have felt a little bit faint or something went on. What we can do is we can interrogate that. It will find when that occurred, if it was an hour ago, 2 hours ago, maybe 3 hours ago, and actually sends it a lot of the time to a laboratory in the United States or in another part of the world, who will then review that and send us the report. Now that's what we do day to day, every day. That's common practice. And that's a really nice example of a form of digital technology that has huge benefits globally when it comes to healthcare. But for that individual healthcare worker and that patient, understanding what's going on, being upskilled and educated enough to really use that technology just makes a huge difference to that patient and also to that doctor.
Yeah, it certainly does. But as I said, I think in many ways people don't realise how much this digital technology has been evolving in the background. So for a lot of the practitioners, it's not new technology. It's just changing and evolving at a rapid rate. And it is going to only better the healthcare for the individual themselves.
Absolutely. And I think it's exciting for people that might be thinking about going into healthcare, about, what are the different possibilities around just doing hands-on medicine. There is going to be a huge world of digital healthcare that you can learn about in, tertiary education, and these will be jobs and professions into the future that a lot of us have. And so it's wonderful to see this roadmap starting to build a way for Australia to just become world leaders when it comes to a connected health system that offers the best.
And it offers new opportunities for those that are coming up and young ones at school, as long as they apply themselves at school, to be able to then learn more about this technology and become a career path.
Absolutely.
It certainly is. Andrew, look, thanks very much for your time, mate. I'm really fascinated by this. Anything else that you've got coming up now, whether it is to do with the patients or the doctors that you'd like to have a chat about, be more than happy to have a chat.
We have got so much coming up, and I am sure we will chat again in the future.
Okay, I've got to ask, Andrew, before we go, are you the certain doctor that appears on a couple of TV programs?
I have been known to be on TV. That is. When I'm moonlighting and not chatting to you on the radio, you will see my head on the TV from now and then.
With a certain panel that are on the TV, I think.
Yeah, now and then.
Okay, Andrew, now I've got your pin. Now I can put a face to the name. So, look, thanks very much for your time.
My absolute pleasure. Have a great day.
See you then. That is Dr. Andrew Rochford talking about the amazing advances of digital technology in medicine and science.